Sleep is essential. You can't function or survive without it. While your body is resting, your brain is a flurry of activity. It organizes the day's events and files them into storage so you can easily retrieve them later. It also catches up on housekeeping, clearing away wastes that build up during the day. The more deeply you sleep, the more effective your brain is at cleaning itself. Adults typically need 7 to 9 hours of sleep for maximum brain performance, but many of us don't get it. Too little sleep negatively affects your ability to remember and concentrate. It can also make you moodier and more irritable, and increase the risk of anxiety and depression. In addition, going too long without sleep has similar effects to being drunk, impairing judgment and performance, and increasing the risk of accidents and injuries. Over time, a lack of adequate sleep may also increase the risk of dementia. To ensure you're getting enough sleep, practice good sleep hygiene. Put away electronic devices an hour before bedtime and do something relaxing. Go to bed at the same time each night and wake up at the same time each morning. Avoid stimulants like caffeine in the late afternoon or evening and alcohol and heavy meals before bedtime. Keep your bedroom quiet, cool, and dark. And try to get in at least 30 minutes of moderately intense exercise on most days, which can improve both sleep and your overall health. The better you sleep at night, the better your brain will function, and the better you'll feel.
What time should we leave tomorrow?
I think about 8. What do you reckon?
Yeah, that sounds about right. What time should we leave tomorrow?
I told you, 8.
What time should we leave tomorrow?
We're leaving at 8, Jane.
What time should we leave tomorrow?
I think we should leave at 8, love.
Good afternoon. Welcome, everyone. I'm so thrilled this afternoon to have all of you here. Okay, today is your mental well-being matters. Okay, so I'm so happy to welcome all of you here this afternoon, Saturday afternoon. I'm sure you care about your mental well-being, right? Okay, so as we navigate through the challenges of today's fast-paced world, we understand, we are getting more and more understand the importance of mental well-being and also to taking care of our mental well-being. So this is why today's session is for all of you. All right. Okay. So today I'm so excited to be able to sit here to speak to our esteemed Dr. Chin, okay, about this mental well-being, in order to help you all to understand more about this mental well-being. Okay, our Dr. Chin is he is a hospital director of one of the public hospital in Sarawak. He has been serving the nation since 2009. He completed his medical degree in Kyrgyzstan Medical University in Russia and obtained a Bachelor of Medicine and Bachelor of Surgery at the same time. All right, okay. So Dr. Chin, personally, I'm very, very thankful to Dr. Chin, because when I extend my invitation to him to share with us about this, to help all the audiences to more aware of this mental wellness. To be very honest, Dr. Chin never have a second thought. Immediately he asked me, get a date from me, okay? So thankful to Dr. Chin, okay? So Dr. Chin, I'm so good to have you here today, Dr. Chin. Okay, so thankful, so happy to be able to speak to you today, Dr. Chin, to help us to understand deeper and aware the importance of mental well-being. Okay, Dr. Chin, are you there? Hello, Dr. Chin. Yeah,
Hi, Sarah.
yeah,
Hi,
Dr. Chin. So good to have you here. So excited. Thank you, Dr. Chin.
hi,
Yeah,
thank you.
Dr. Chin, I understand in today's world, talking about cardiovascular disease, high blood pressure, even cancer, all kind of physical wellness is a norm in the society. Every day we heard people talk about, obesity is a problem, weight is a problem. But to be very honest, I hardly hear people discuss about mental wellness. Okay, so I wonder, what is the relationship between mental well-being and physical well-being? Especially just now, the second video it mentioned, it's not about getting old, it's about getting ill. Okay, Dr.
Yes.
Kim, can you explain to us about the relationship between the two?
Okay. So, thank you, Sarah. So, hi, everyone. I'm Chin. So, mental wellness is actually not really being recognized by people nowadays because it is actually forgotten by people when in the society, but they're more focused on our physical well-being. Okay, what is actually difference between the mental health and the physical health? Actually, they are interrelated. Okay, physical health means what is can be seen on our body, means that our function of our body, the healthy health of our body, okay, to do our daily work. However, mental well-being means that it actually is comes from our mind. It is when our mind is in the correct order, is functioning well in our best interest, that can help us to act correctly in our daily life. It is called the mental well-being. So when our mental well-being interrupted, when our mental well-being got some problem as we age, or some people actually even have some mental health issue during their childhood, it actually will in turn, it will act differently from other people. For example, because our brain, it help us to think and feel, then only we act based on our feeling and our thinking. So if our mental well-being is being interrupted, they will feel it differently and think it differently. For example, some of the people, like for normal people, when people do something on us, we sometimes will feel angry. However, we will not do anything to revenge or anything. However, for those like bipolar people, bipolar patient, they will think that I must do something, I must do revenge. That is why some criminal cases appear. This is when our mental health will be interrupted. Like for some of the people, that when we, like normal people, when we face some challenges in life, which every one of us, I believe, we face some challenges in life. If we got some issue with our family members, or friends, with our partner, then we'll find a way to overcome it. We are think positively, okay, we are talk to people. However, those with like anxiety or depression, when it means that their mental health is being interrupted, then they'll act differently because they feel that, okay, nobody cares for me. Then I'll go. I think I'm useless. I'm useless for this world. Then they'll go for commit suicide. That's why when our mental health is being interrupted, we are unable to think and feel correctly like others. Then we are actually act differently. So our mental health, it will actually affect our physical health, because when we got some mental issue, then it will actually affect our hormone, our heart rate, our brain, and so on, and it will actually affects our health. However, at the same time, vice versa, when our health got some problem, got some hormonal problem and so on, then it will actually affect our mental well-being also. So it's interrelated. Yeah.
Oh, thank you, Dr. Chin. I mean, how we think, we feel, and act accordingly. Okay. So just now when you explained the relationship between them, I start to imagine this is an important area, you know, I mean, mental well-being, mental feelings, okay, that has been neglected by maybe a lot of people, right?
Yes.
Yeah, I mean, Dr. Chin, the second video, you know, I had watched a few times. Every time I watch it, my tears, I mean, I'm still tearing, okay? Why? I want the audiences to imagine if this is your loved one, or maybe yourself when you're old age. Jan has been reminded by her spouse 4 times. What time shall we leave tomorrow? I mean, she has a very patient spouse, okay? Not everyone as lucky as Jan, right? Okay. I believe all of us do not want to end up like that also, correct? I don't know. I mean, when I watch this video again, you know, now I think back on the scene, I'm very emotional. I mean, over time, in the first video also mentioned, over time, lacking sleep will increase risk of dementia. Maybe sometimes, maybe around me, I have a few friends, okay? I knew them when they were well, and now they have this issue. When I watch this video, I'm thinking of my friend's image. I feel quite sad, okay? I feel quite sad. At times, I also don't know whether she really remember me. Okay, I mean, Dr. Chin, is memory part and parcel of mental well-being?
Yes. When we say about this memory, the memory for me as a medical doctor, it actually carries a different definition. The memory can be can have pros and cons. Okay, memory actually help us to recall everything that happened throughout our life. However, the pros of our memories is help us to carry our daily job. If our memory is not good, then we will forget everything lah. Like when we age. But when the memory is too good, like we in some of the psychiatric, in the field of the psychiatry, we always said there is a condition when the memory is too good, when a person carries the memories and cannot let go of it. It actually carries an issue also. Because in our daily lives, we face challenges. In the journey of our life, we have ups and downs. Okay, we have challenges. We got issue with the society. We have ever fight with our family, our friends, and so on. And even there are a lot of things is we have our problem with our partners. Our partners betray us, and so on. This is what happened in the society. However, when we face these challenges, or we are days like someone passed away, our loved one passed away, and so on, this memory is challenges in life. We might not be able to escape from it. However, for a normal person, most of us actually can face it because we knows that these challenges, and when we tend to think positive, then it will go over already. So this is part of our journey of life. But there are people, I believe that everyone heard about other people's stories, like they cannot forget about what had been happened. So some of them they got this kind of condition called PTSD, is post-traumatic psychiatric disorder. Then we carry that, then we go into depression, anxiety, schizophrenia, and so on. So this is part of our too good memory. This is the cons of our memory. However, when we talk about memory, when we age, our memory will actually start to have a degeneration of our memory. Like as for me, okay, during my early days, when I was still a student, I used to be a very I mean, like my memory used to be very good. Like when I study doctors, I need to spend a lot of time remembering all those terms, skills, and so on, so that I can carry out my daily duty. That's why that time I can multitasking. I can while listening to music or while listening to other people say, I can do my notes, or I can do a lot of things. However, when we age, then we tend to have some decreasing in our memory ability. Like I don't know whether you ever have this experience or not. It's like last time you can remember a lot of things. However, now when you try to remember what happened 1 minute ago, you need someone to actually recall. That's why now I have actually a notebook with me. I tend to write down what I need to do until it is not like only those job that I need to be done, even as small as buying a pen, even as small as sending an email, pay my bills. Like this kind of thing is like sometimes I will think, hey, this kind of thing, I just do it lah. I just do it. I don't need to write down lah, right? However, after a few minutes, or someone call me, or someone just talk to me something, then I'll forget what I need to do already. Then after a few days, then my friend would ask me, hey, where's my email? I was like, hey, I was just thinking about it just few minutes that time. How can I just forget it? But this never happened during my student time. This is, I don't know how many people are same as me. So the memory actually decreasing when we age also as well. Even the people around me also, like my mom. My mom, like always it happen lah, because my mom already 60 something. So like for example, some of the time during my when I was still a child, I like to eat something. I like to eat something. Then, however, there are food that I doesn't like. However, when my mom cooks something, then I say, hey, I thought I didn't like this food before this. He said, no man, you like to eat it when even all the time. I said I never like to eat this food. That's why I can feel there are a lot of things actually my mom already forgot. It is not that it is not like already memory loss, but there are things that the memory already is interrupted already. Yeah. So this is what memory brings us when we age lah. So a lot of time also the I don't know whether you ever heard or not. I've got a few patient that actually sent into my hospital for the care of the geriatric. Okay, because my hospital is located quite far away from the tertiary hospital, which is a specialist hospital. That's why there are social issue patient, the old people, then they were sent to my hospital for our nursing care. I got a few cases that they actually doesn't remember the people, their family members around them. However, they got ever wrongly recognized me as their son or someone instead of the real son and so on. So this memory, even they ever ask me, hey, where is your father? I was like, hey, do I know you? He said, huh? How come you don't know me? I'm your mom. This is how the memory actually affects them. That's why I also used to come across a case that the husband is just next to her, but she actually cannot recognize him anymore. This is what's the case that I saw lah.
So Dr. Chin, I mean, I also have that experience like you, okay? At times I find I cannot remember the name of the restaurant I went. I used to go, for example, okay, I need to take longer time to recall what's the name already, okay. So I mean, the memory, of course, is not as good as previously when I was younger. So I mean, talking about this memory ability declining and also Alzheimer, are they similar category? Like for example, right now, okay, of course, compare like what Dr. Chi mentioned, compare to previously, whereby you can multitasking, okay, and now you got to write down even notes. You need to reply an email. I totally can understand what you shared earlier. So I mean the example like this, is it related to the risk of having Alzheimer?
Alzheimer actually, there are a lot of because Alzheimer, it got a lot of etiology, means there are a lot of things that actually lead to Alzheimer. It is not only the memory losing issue. It is like forgetfulness. If we are forgetfulness, it doesn't mean that we have Alzheimer. The Alzheimer sometimes is like they can recognize some, but sometimes they cannot recognize anything. The forgetfulness is sometimes we tend to forget something, unable to, or because Alzheimer, even when you I mean, like when you remind them, okay, this is your who, they cannot remember. However, forgetfulness, when we tend to forget something, like I forget to send an email. When you remind me, then I remember already. That is forgetfulness, means that it's easy to forget. However, Alzheimer, you even you remind them, they cannot remember also.
Oh, okay. Oh, that is the difference. So I mean, is Alzheimer, is a genetic DNA playing a big role in Alzheimer?
Alzheimer, of course,
or
DNA
dementia?
also plays a role that people might have risk more prone to have Alzheimer. But in the modern days, even the genetic, I mean, like some people they do not have the ancestor, I mean, the genetics, it will also have this Alzheimer due to some unhealthy lifestyle in their, I mean, done by them.
Okay, unhealthy lifestyle. So I believe lacking sleep, not having enough sleep is one of them.
Yes, correct.
Yeah. Okay. So I mean, for the lacking, I wouldn't say it's a memory loss, but not able to recall things, to remember things as good as previously. So this is considered part of mental well-being. So people at stress, too stressful all the time. Well, this category of people losing memory, not Alzheimer, but forgetful intent. The tendency of forgetful is higher than the person have a lower stress, for instance.
Yes, of course, because the bigger stress can be from any form. When we are in the society in the modern days, a lot of us might not be working, but we are facing the stress as well. Because stress doesn't not only come from work, but come from family, come from the society, any place. Like when I study psychiatry, we are actually reminded by we are being taught to actually to dig more deeply about a patient's story, their background. For example, a person who is getting married, for us, of course, it's a good thing, right? It's a good thing. Also, wow, you are getting married. It's so sweet. You're going to have the wedding reception, photography, and so on. However, this so-called getting married can be a good thing, can be a sweet thing, but it also can be a stress for some of the people because they are stepping into a new chapter of life. They need to figure out their new life. That sometimes that they can figure out, I need to stay with a new person, my in-laws, then a financial problem and so on. However, this thing they might not share with people, but this is one type of stress that can lead some of them into anxiety. Yeah, this is stress also as well.
Okay, stress
Yeah.
can lead to forgetful. And this is very interesting. Yeah, no wonder. I came across a friend, the groom disappeared on the wedding day, and then the reason is I'm not ready. I think he had dipped hot the night before, okay, and then the next day he disappeared, and then he called the wife to be, okay, I'm too stressful, I'm not ready, I don't think I'm ready, to get married. Okay, I want to stay single. So it's very interesting. I mean, of course, back then we don't understand the mental well-being. Okay, so I think this maybe relate also to a person's ability to take stress. We usually have a term called stress threshold. Okay, your ability to handle stress. Okay, so what is the possibility of stress bring damage to us, Dr. Chin?
Okay.
I mean, there's
Stress.
two questions here. The stress threshold, because like what you mentioned, like dying of your loved one. To some people, we accept it. We know this is a part of a journey of life. Yeah, I came across a friend's mom. After his dad passed away, his mom went into depression gradually within a year, okay, until she couldn't take care of herself anymore. So just now Dr. Chin mentioned earlier, it suddenly triggered me. Maybe certain people, the ability to handle stress. So passing of a spouse become a PT, what the post-traumatic psychiatric disorder, right? Okay. So is it the stress threshold? Two person with different ability to handle stress. Is this a genetic as well? Okay. Second question is, will this bring harm to our brains or damage our body?
Okay. Stress, like I said, we face different type of stress, and it is actually unavoidable. However, I think stress, personally, I think stress, the threshold of facing stress, it actually comes from how we actually handle ourselves from our background. Because some of the people, like for me, last time I was a person that actually is a very low threshold in handling stress. However, when I slowly grow up, I read books and so on, then I can manage stress quite well. But of course, the stress, it also depends on how you actually think of it. Like I say just now, our brain, we think differently on think the same thing that happened. We think differently, feel differently, and we act differently. That's why with different people, the same thing happen. We actually feel differently. That's why we act differently. So okay, so the stress, when we want to face it, we actually need to learn how to face certain stress. Like some people, they actually given enough time to actually go for traveling to release their stress. For example, even our psychiatrists in psychiatric department, they got more leaves. They can apply more the annual leave more than us, like the normal doctors. I say why? Because they said because they every day need to listen to different stories of the psychiatric patient. That's why they will have a lot of mental stress. That's why they will be given a lot of leave for them to actually clear their mind. So this is one of the way that you can release stress. However, there are certain people when they have stress, when you tell them to go for a leave, they will say that never mind lah, I got a lot of things to do and so on. They do not want to face the reality. That's why different people they act differently to overcome it. Some people they think that they know they are being stressed, and they know they need to do something, but they refuse to do it. This actually lead to more mental problem. Of course, the second question just now, the stress also lead to a lot of problem, especially in our health. If you go to Google, actually you go and type stress induced disease, then you'll got a list. Like for example, heart disease. When we got stress, we actually some of the time we got stress, however, we are unable to realize it. you know. Like one time, actually, I feel that I'm okay. I don't have any thing, but however, when I only have a bit headache. I thought I didn't sleep well, that's why I have a headache. So I went to a Chinese physician. So when after some checking, he only looked at me. These days a lot of stress, is it? I said no, leh. He said, do you know that your heart rate is actually not that good? I said, my ECG is good. I think I actually when I check my pulse is good. He said no. When I touch your pulse, in your pulse actually got some kind of symptoms that shows that you are being stressed recently and you think a lot. Then he checked on my head. He said a lot of vessels in on my head are got some issue. It shows that you are facing a lot of stress lately. He asked me, don't think too much. Yeah, that's why when we are being emotionally stressed, sometimes we might not realize, and it will disturb our hormones. It will increase our heart rate, and sometimes most of the time it will increase our craving for food, and eventually it will lead to heart disease. It will lead to obesity, and also the insulin resistance. Of course, when we are being stressed, our respiration, our breathing is also being disturbed. Then, like myself, I said just now, I got headache and I got frontal headache. It is actually, if you Google it, frontal headache also means that tension headache, which means when we are stressed, actually we will feel sad. Also, a lot of people didn't realize some of our GI problem, our gastrointestinal problem, like our GERD, our irritable bowel disease, our gastritis, actually is induced by our stress as well. Okay, and like Sarah mentioned just now, the Alzheimer. Long-term stress actually will lead to one of the reasons to lead to Alzheimer also as well.
Oh, stress also lead to Alzheimer.
Yes.
Wow. Wow. Okay, so I mean, I can totally relate to, about the GI disease or this thing, because now I recall back 15 or 16 years ago, I was admitted to hospital almost every year, Dr. Chin, for my gastric issue. I had a gastric ulcer every year.
Okay.
So of course, this is a question maybe I ask you, Dr. Chin. Is it possible some people are trained to be very resilient? Okay, like you, okay, you don't feel you are stressed, but the Chinese physicians ask you, are you very stressful lately? You say, oh, I didn't know. It's exactly like me. I didn't know I was stressful in my previous job, okay, and but I had this gastric issue very often, and admitted to hospital twice. Having long-term medications as well for my gastric. Okay, so at that moment, of course, I take it as maybe I born with bad gastric, bad stomach. I can't eat a lot of things. That's the reason why I have this gastric issue. So interesting enough, after I stopped from my previous job, thank God, okay, this thing never come back. Okay, so now, of course, we are talking about this stress-related ailment. So it helped me to link back, long-term stress. Probably at that moment, I was so resilient in my job, I didn't even feel I was stressful. Okay, just you have to complete the task, think differently. Okay, I think I slept quite well, every night I slept well, but I didn't know my body was stressful. Okay, so it ended up have these all GI issues. And of course, Dr. Chin, about this stress, all right, okay. So I believe in today's modern society, there's no way we can escape stress. Wake up in the morning, maybe the kids or the baby already stress us, right? If the babies keep crying non-stop, you're so stressed, what happened to the babies, right? You just have a baby son, I know, you understand the feeling, right? Okay, and the moment you step out from the house, we never know. It could be that there is excessively, jam. The traffic under long-term stress is common. Yeah, thanks for Deepu for his comment, gastric ulcers. Yeah, I mean, Dr. Chin, is there any way, any strategies can help us to manage our stress to minimum? to minimum, you see. Of course, I had been reading like natural remedies. Some people use aromatherapy, you know, or maybe essential oil massage, or drinking any kind of herbs, herbs teas or anything. Is that can help us?
Yes, I think first of all, I also have a read through lah. There are a lot of things that I also try to make myself less stressed. Like Sarah said just now, last time we actually we didn't feel that we are stressed because like me as a hospital director, I used to thought that a hospital director only need to do some paperwork. However, in my position, I even need to do engineering works. Even the people some of the time ask me, doctor, what kind of wire do you want to use? I said, how do I even know what kind of wire do I need to use? What type of cement you want to use for the building? I said, how can I know, you know? This kind of thing. Then I need to do audit. I need to study new things, which I never been taught in my medical school. This is so for the past 10 years, for me, I am not that stressed because even I need to handle a lot of things. I think it is my normal daily work. So this is even when people ask me, don't you are very busy, I say, okay, I'm okay, nothing. You know, however, after I think I know that being informed by the Chinese physician, I go and read up what can actually release my stress so that I can you know, have a better mental health, you know, even related to my health problem. Okay, so I actually read through. Of course, the first thing that they mention is our lifestyle, because the in the modern days, I think the lifestyle of our modern people is actually not that actually good. We thought that we are good. Okay, the lifestyle, they actually prompt us that we should actually do exercise, because a lot of people, they think that okay, I don't really eat that much, I not really that obese, okay, I do not need to exercise also, it's okay. But I read through, when we go exercise, it doesn't mean that we need to slim down only we go for exercise, because exercise will help our metabolism and also the blood circulation, and also will also help in our hormone, hormone wellness and so on. So exercise is actually essential for our healthy lifestyle, and also of course the healthy food, you know. And also the most important, they mention about we should make our sleep our priority. In the modern days, especially the introduction of our smartphone. Okay, everyone is carrying the smartphone and play the smartphone until midnight. I for sure, be it you are a doctor or you are a housewife, after the baby sleep, then first thing you do is playing with your handphone. Especially now, we got short videos market. We got our TikTok and so on, our Instagram. Then you are feeling that you are not that stressed. Also, you're playing with our that one. You believe or not, ask yourself, the first thing you do when you wake up in the morning, what do you do? Most of the people go for Facebook, Instagram, TikTok, and so on. Right? Okay, so this is our lifestyle now. So, however, when we play with our handphone before we sleep, the light of our handphone will actually cause us to actually difficult to fall asleep and disturb our sleep. So actually, to overcome the stress, actually we should actually make our sleep our priority. The way of making our sleep well, actually in the first video, it mentioned make the room good environment for our sleep, including the lighting, including the smell. You can use some essential oil, then put your electronics device away. Yeah, this is we really need to be remind ourselves, sleep is always our priority. Yeah, this is it.
Wow, thanks, Dr. Chin. Yeah, I mean, this help me to think back. The invention of a light bulb, electric light bulb, is to bring the humans convenience, but at the end, it also causes sleep issues. and stress
Yeah.
issues. So it's very interesting. Yeah. I mean, Dr. Chin, sometimes I also tend to, to come across people like had a accident, car accident, what I'm saying. Okay. And I remember one time one of my friends had a car accident, and the reason she told me is actually I'm fine. It's just I lost focus during the driving. Okay, during her drive, she lost focus. So I was just wondering, is focus also part and parcel of mental well-being? Maybe is the consequences of having too stressful life or lacking
Okay.
sleep? Yeah.
Focusing on something, actually for me, sometimes it's very subjective. Some people, they actually used to only focus on one thing. They can only do one thing at a time. But some of the people, they can multitasking. They can do a lot of things, you know. However, our brain actually undergo the anatomical and neurological changes where when we age over times. You know, when we age, it actually takes longer for our brain to actually absorb and process and also remember the new information that we're studying in. So the natural loss of these receptors, also neurological changes, actually make us harder to concentrate because we not only we it actually make us learn information actually more slowly and having trouble to recall it because we did not really learn it at the first place. What does it mean? Okay. I don't know whether you have ever come across this kind of situation or not. Okay. If you are reading a book, you are reading articles or news, okay. However, when you finish reading it, you macam thinks that, I know about this, but it's like a puzzle losing a few pieces. So just now, what did I read? I think I read about this. So you go back and read it again over.
Yes.
This kind of this is information. And also another information is that you already finished reading an article. You think I know about the story already. However, after that, your friend asks you about, hey, you read about that news or not? Hey, you read about that story or not? Hey, I read already leh. Hey, you cannot tell me? So when you want to tell, you feel that you are stuck. I thought I read
Yeah.
already leh. I know about that, but I forgot what is the name of that thing. I forgot what is that. It got something missing. It is not because you got memory loss, you know. It is because when you read it, you suddenly your brain will actually come across some information. Then that part of you only see through that thing, but you didn't remember it. That is also one type of the losing focus. This thing, I myself, I always face it like, last time, read through means read through, I can remember everything. But nowadays, sometimes I read through even some Facebook posts. I read already, read until the last paragraph. I was like thinking, what did I read just now? Then I go back to read again. This kind of situation. So when we age, because our neurochemical, our chemical in the brain, it is actually degenerating over times. Then it will actually make us lose our focus as well.
Okay, you answer my questions. I was just about to ask you, is this also an aging issue? I try to recall, I think I was smarter when I was younger. I only read once or twice. I can remember. Now, yeah, you're right. I have to read 5 times sometimes, especially complicated stuff like what is the height, how long, the length of certain things, read through. Or maybe, yeah, I think this is ability to focus. Sometimes we just glance through, but not really put attention to every single word. So this is the reason of degenerations of the neurochemical. This it's quite scary also. How to overcome, Doctor?
Yeah.
Right. Okay. So okay, maybe if we have talked about all these, I think quite interesting, our memory, our focus. Okay. Our friends mentioned when she was young, she can remember song lyrics. Oh, okay, you are right. Yeah, now I can't remember lyrics. Yes. I don't know
I
this
find
is
like you sleep
memory or
for
focus.
more time, they will remember already.
Yeah, I think maybe also because we grow up, we have so many things to handle. We have so many things to handle. So the capacity is very packed. Okay. So maybe the last part, I'm very curious to know about our mental well-being. It's about sleep. Back to the first video. It looks like just now you mentioned for memory, sleep is priority. For focus, maybe sleep also priority. Just imagine if last night I didn't sleep well. Today, okay, maybe I have difficulty to focus 100% when I'm speaking to you, doctor, right? Okay,
Yeah.
so maybe about sleep issue. I want to know your definition about sleep disorder. What is really classified as sleep disorder?
Okay. A lot of people say that, yeah, I sleep, but you sleep or you sleep well is two different things. Because sleep, the definition of sleeping disorder, of course, is unable to fall asleep or remain asleep. What does it mean by remain asleep? It means that if you wake up 6 times in the night, do you think you got enough sleep or not? Okay, did you sleep well or not? Because sleep, it actually is it very depends on your sleep well. Actually means that you sleep at a good timing. Did you sleep through overnight or not? Because sleep, it actually went through a few cycles, a few cycles. And the cycles, it actually need you to continuously sleep at least for 4 to 6 hours. It can actually maybe like you completed the sleep. Naturally, the sleep, when the cycle, the unREM, non-REM and the REM cycle. Okay, when we in easier words lah, in short, is that when we sleep through overnight, then the cycle will continue in the correct manner. However, when we keep on awaking due to some reason, due to stress, or due to we need to wake up, go to the washroom, or anything, we keep on sleep and fall asleep, fall asleep, then the cycle need to be restart and restart and restart. And so at the end of the day, although you said, oh, I've been sleeping for 7 hours, however, your quality of sleep is not good. So when you wake up in the morning, you will still feel very tired also as well. Yeah, this is sleep.
Okay. Yeah, I like that. Not only sleep at the good timing, remain sleep. Okay. No wonder. Okay. Culturally, when we meet our friends, we sometimes will ask, do you sleep well last night? Right? Okay. Especially when I talk to my kids. Okay. The first thing when I call my daughters is, you sleep well last night? Okay, now I understand. Yeah, it's true. Okay, so this is a definition of sleep disorder. Yeah, going to washroom, I think that is also another issue. I mean, when I talk to, my customers, some of my customers, one of the main reason they couldn't remain sleep is they keep going to washroom. Okay, so maybe this is another topic we can discuss another day. Okay, I understand some people, when you don't sleep well, the first thing people think of is, I want to take okay, sleeping aid medications. Okay,
Yes.
this is the prescriptive medications, right? Okay,
Right.
we can't buy on the shelf or in pharmacy. You need doctor to prescribe. All right. Okay, so Dr. Chin, is taking sleeping aid medication a solution for those people who is having difficulty to fall asleep, insomnia, people with insomnia? Is it a long-term solution?
Okay, for sleeping pills, maybe I talk about it first. Sleeping pill itself is not only a prescriptive medication, but most of it is a psychiatric prescriptive medication. Even me, myself, sometimes is unable to buy it or prescribe it. It need the signature of a registered psychiatrist. Even some of the medication is not available over the counter in Malaysia also as well. Like some of the melatonin actually need to be imported from Singapore. So the sleeping pills actually is very difficult to buy in Malaysia. Is not available because it is, of course, it is not a solution, and it is not advisable to take, especially for long term. It's for short term to just to settle the problem, then it's okay. But for long term, it needs to find out the real issue, what is actually happened to that person that disturb the sleep. Because sleep, there are a lot of condition of sleep, different type of sleep disorder. That's why, of course, sleep, lack of sleep, it will not only disturb our daily activities, like say I feel tired. Also, if in the psychiatric clinic, when the psychiatrist is assessing the patient, the normal common question is they will ask the patient, did you sleep well? Because sleep, when they are unable to sleep well, they for long term, it will actually disturb their mental health, and it will eventually causing them to think a lot. That will lead to a lot of different kinds of mental illness. So sleeping pill itself, it will the usually we worry about the dependence of the sleeping pill, because when you start taking sleeping pill, it will cause dependence. Means that it will how to say, sleeping pill, you will eventually you only need sleeping pills, only you can sleep. Then without sleeping pill, then you cannot sleep. It will cause dependence. Also, sleeping pill also one of the how to say, also it will cause tolerance. Means that you take for some period of time, then after that it will you after that you take it, it will no longer work for that patient anymore. It will call intolerant, the tolerance. Then so after that, there are a lot of side effect also to the heart, to the brain, to the memory, and also to the sex drive. Yeah, due to these side effects, also some of the how to say, the sleeping pills, I ever tried once, I ever tried once. It was a very low dose of the relaxation pill lah. I tried to sleep. I actually sleep for more than 10 hours until I cannot concentrate on my job. That's why after that I don't dare to take anymore, because it will actually, you when you take it, you cannot control whether you want to sleep or not. You will sleep through. Then after that, you actually you need to wake up for work. You also cannot wake up. So this kind of a lot of these side effects. That's why we need to be very careful, and it is not a long-term solution for that.
Okay, so I mean, from this scenario, I can summarize that a good, I wouldn't say pill, I mean a good sleeping aid, medications or supplements or whatever, it shouldn't cause us groggy or dizzy the next day, right? Okay, so like sleeping pill, the next day after 10 hours, you still feel like sleeping groggy the whole day. So I think it doesn't help to help the patients, okay, or the customers, because the purpose of sleep is to give us a better concentration the next day, to focus better, have a better memory, can focus on our job, right? Okay, so doctor, just now I heard a term from you, which is a concern to me. I think very interesting. This sleeping pill is only available in psychiatric clinic.
Yes.
And also inability to sleep, have to see psychiatric doctors, psychiatrists lah, okay, go to psychiatric clinic. So why suddenly this term hit me and I feel so interesting. Most of the layperson, we just take can't sleep better or can't sleep well or take it lightly, okay? We didn't know it is a psychiatric, maybe I don't want to use the word disorder, that it seems a bit heavy, okay? Can I say in long term, unable to sleep well, okay, inability to sleep, or insomnia for a long period of time, or low quality sleep for a long period of time, in long term, it will lead the person into psychiatric disorder?
Yes, of course. A lot of psychiatric disorder is due to unable to sleep for a very long time. Also, even for a short period, sometime like I think you most of us ever heard, yes, when we go to clinic, if we measure our blood pressure, when the blood pressure is higher, most of the patient will tell me, oh, because last night I didn't sleep well. You see, this condition actually tell us that a lot of people knows that unable to sleep well overnight actually can cause our blood pressure to increase. You see, so this is only short term, means that if you rest well over the night, then after that your BP will be okay. So long term, it will actually cause the person to have a lot of hormonal changes, and it will lead to a lot of psychiatric issue.
Wow. Wow, thanks for mentioning this. I didn't even know sleeping pill have to get from psychiatric clinic. And people who have sleeping issue have to go to psychiatric clinic as well. Really, okay. So it also, highlight to me how important is sleep. No wonder, I remember one story. There was a friend's friend, okay, a friend's sister, okay, called me. My friend called me, asked what kind of supplement we can help the sister. I said, what happened? The sister didn't sleep for a few nights and getting crazier. She used the term, okay. But of course, after that, I asked her to refer to go to hospital, see a doctor, okay. So of course, the doctor also giving her that kind of sleeping pill, prescriptive medicine, because something happened in her life, like trauma, okay. So I think, Dr. Chin, you have mentioned about, this pill, what is the consequences? Okay, let's talk about sleep disorders. Can you name us a few, physical well-being, okay, physical health that impacted strongly by sleep disorders in long term? Just now you mentioned about the psychiatric disorders already, mental. How about physical, other than high blood pressure, high heart rate, any other physical well-being?
Okay, maybe before that, I suddenly thought of one thing, okay, which I actually neglected or forgot about before this. I used to talk to a friend, then he asked, oh, where is another friend? He is a ENT surgeon. He is ENT surgeon. So he said we got a friend that actually goes to Japan for further subspecialty. And the further subspecialty, do you know what he actually studied? He studied about sleeping tests. You see, sleep test is also one of the specialty in the ENTs. The ear, nose, throat. Okay, field specialty. So they actually, a lot of people, they need to perform the sleep test so that they can know how the sleep pattern overnight. Then they can diagnose a lot of issue that actually causes the sleep problem, because as we know, as we mentioned just now, inadequate sleep for long term can lead to a lot of things. Okay, so the one of the thing that actually can lead to sleep disorder is the sleep apnea. Okay, when we got sleep apnea, obstructive sleep apnea, is the OSA, then it will actually cause us to keep on waking up in the night when we cannot breathe. Okay, sleep apnea can cause us to sleep unable to breathe it's not breathing for 40 seconds if it is very, very serious. So when only we perform the sleep test, then we will know about that. Okay, back to the question just now. What if we long term cannot sleep? What will it lead to? Is the increase in the heart rate and also the blood pressure. Because a lot of people, they when this happen, we are in inadequate sleep. Then when we want to focus, then it will actually disturb the body vital signs like the heart rate, the blood pressure, and so on. So and when you see when even when there is a baby, our kids when not enough sleep, what will they do? They will become very frantic, emotion got good, unable to focus. You see, even a kid also will, because of inadequate sleep, lead to that. or sometimes even it is not only adequate, you know, you need to sleep at a correct timing, you know. It's only not only like oh okay, it's okay. I can sleep at 3, then I wake up at 12 o'clock in the afternoon. Yeah, it's 9 hours, but it's not correct. It's not correct sleep pattern also as well. That's why us as I mean like medical professions like the nurses, you know, doctors, that we need to on night shift or we need to on call, then we sleep at a.m. in the morning until 3 a.m. I tell you, even after how long you sleep, you will still feel very tired, you know. That's why the timing of sleep also will disturb our mental health being. We can unable to focus and so on. That's why when we long-term being in this kind of situation, it will actually cause our brain, because our brain need to because our when we sleep, it actually not only we resting, you know, when we sleep, it actually help our body organs. It actually detoxing, means that every toxic that one they will give you a detox during our sleep. And the repairing system is just like our skin. Our some of our skincare actually only use at night. Why? It's because overnight it only repairs. Only when you sleep it can repair. During daytime when we're working, our skin will not repair. Same as well as other organs as well. They repairs and detox during night time, when I mean like during when we sleep. So sleep is very important. If we don't sleep, our body long term cannot detoxify. Our body long term cannot repair. Think what will happen with that. Yeah, this is.
Okay, I guess this is what we always mention, rejuvenating. Okay, sleeping, deep sleep is a rejuvenation, right? Okay,
Yes.
doctor. Yeah, okay. Thank you so much, doctor, for highlight to us the importance of sleep, and we shall prioritize sleep. Not only sleep, I learned something, correct timing. Okay. The first thing came into my mind was our body has an internal clock, right? We have internal clock. Why this thing you know, I have this I can feel it because every time when I travel different time zone, okay, so I really had difficulty to adjust compared to younger days. Okay, maybe okay, this is also part and parcel of I don't know whether this is a part and parcel of aging, ability, your body ability to adjust your circadian rhythm in within your own body is taking longer time to adjust.
Yeah, actually our body, it actually you know, our body, the best part in our body is actually it adapts well to the timing and also that one. However, when we over times when we our body age, the ability to adapt to the environment and timing is also decreasing in that one. That's why those people that actually traveling in here and there, they also need to have their way to sleep well. So
they must learn the way to be able to fall asleep at the right timing and adequate.
yes.
Thank you, Dr. Chin, so much. Okay, so doctor, your final advice to all the audience over here. What are the important strategies for all of us who can, I mean, practically adopt to take care of our mental well-being we can do at home?
Okay. I think in the modern days, especially now, okay, there are few things I myself, even I myself is try to practice lah. Okay, is of course the top priority is we need to sleep well. Like I said just now, the make yourself away from the electronics device. Okay, at least lah 1 to 2 hours before you sleep. Okay. And the second thing, we need to stay positive. Stay positive is not just a slogan or those you always see those like what MLM slogans, you know. Oh yeah, stay positive is actually need to be practiced by everyone, because every one of us we do face challenges. We do face challenges in our daily life. And you need to accept that life challenges is a is something we cannot avoid, and it is a process of life, yeah, given to us, and everything happen for a good reason, and it helps us to grow. So we some of the things we need to learn. So it doesn't comes if we doesn't know if we did not go and learn. And nowadays, with the modern technology, we might not need to step out from the house to learn something new. We actually can learn from some video, and even we can read some books to for us how to think positively and so on. This is help us to think back. If we read a lot, we learn a lot, then we can actually help ourselves to think better, stay positive when we face some challenges, and also help us to overcome our stress. Okay, and after that, we need to know how to manage our stress. Of course, different people they got different hobbies. This I will encourage more people to go for some exercise. Okay, go out from the house. Don't always I mean like stay in the house. Sometimes yeah. Take your time. Okay, talk to people. Talk to positive people. Yeah. Take your time. Go for traveling. This is very good. In other countries such as Australia, for us in Malaysia, when we have annual leave, okay, around 24 days, 25 days of annual leave. However, if our annual leave did not use at the end of the year, either you can sell it for government lah. Either you can sell it or it's burned if you don't do anything. However, because some of the time even I got leave, I got no time to go for it. So at the end of the year, I still got a lot of annual leave. Some of the time, some of the annual leave you can bring forward, but it got limit. It's not like you every day, every year you can bring forward. However, in other countries like Australia, they got if not mistaken, they got 5 weeks of annual leave that you can take in a year. However, at the end of the year, if you cannot complete, you cannot take you cannot finish your annual leave, you are being ordered to clear your leave. Means that you need to go for leave and you cannot work anymore. This actually is good, is because they want you to have adequate rest, so you can go for travel and so on to release your stress. This is actually being practiced in a lot of developed country. This is how they actually help the people to maintain their good mental well-being lah. So I think no time to play, night time to work, and time to rest is very important lah. Yeah.
Okay, thanks, doctor, for your advice. So after these sessions, I think some of you may have to apply leave from your employer to go for holiday, to de-stress, right? Okay, to recharge. Yeah. Okay. I told you I'm sorry, doctor. That was last questions, but suddenly I have another questions to add on. That is the last, okay? Because I suddenly just recalled, when you were answering the last questions, think positive, all this thing. I recalled suddenly a little client came to my mind. I had a client, the youngest in my list, okay, who, the parents told me this little girl, okay, this is a primary school girl. She always depressed, okay, unhappy, okay, a lot of complaints. So of course, physically she is okay, she's not ill, okay, she is a complete person, all right, and the parents brought her to see a lot of psychologists speaking, and the psychologist told her part of her brain, I can't remember, I think it's HPA, okay, hippo something, thalamus. They may be a little bit smaller or bigger, so she has naturally she is a worrier. I mean, a person who loves to worry, okay. So I mean, because the parent also told me, they counsel her to be happier, positive, and then the girl answer her parent, it's not that I don't want, I cannot, okay, I want, but I can't. So I mean, ultimately, this little girl also one of my clients to check her genetic test. Of course, this test result shows that she has a very high anxiety genes in her. So again, back to the questions, okay? I just this just curious me lah, okay? I feel a bit curious, okay? So after this test came out, then I told the parents, yeah, not sure it's which side of the parents, maybe it's father or mother, maybe have a higher this part of higher in these genes, always anxiety. Okay, yeah, anxiety. This little girl always anxious for things never happen, actually. Okay, like teacher's going to scold me today. Teacher is going to, because she refused to go to school. She refused to go to school. She always think the friends will do this to her. The teacher will do this to her. All these things never happen. Okay, all these things never happen. So of course, my last question is, can this again, this thinking too much or overconscious, anxious, gene run in the family as well?
Yes. When we say about the PSY, I mean like the mental problem. When I actually goes to psychiatric clinic, when I talk to them, when I see how they actually interview patient, they actually, or even me myself, my colleague, we interview the mental issue patient. We also need to find out whether there is any family history of the mental illness, because the mental, I mean like this psychiatric of issue actually is being carried by the gene also as well. Like one of the comments said that the HPA is actually about implication about anxiety disorder. Okay, is of course it's not only the brain structure, also some of them is because of the hormone and so on. And what I can be sure is that the genetic actually carries this thing to, yeah lah, it will actually brings the outcome to the next generation as well. If the family have this mental illness, then actually the next generation will more likely to get it as well.
Okay. Thank you so much, Dr. Chin. Thanks for 1 hour plus. Thanks for your time. Okay, and of course, to my dear audience, thanks for joining us today. I believe all of us learned a lot from Dr. Chin today. It's a very, very helpful discussions. Okay, it's a very helpful talk to help me, and I believe the audience online to learn more in depth about mental well-being. Okay, so I think lastly, okay, of course, Dr. Chin has advised us, okay, what to do. I think the things I remember from him is go holiday, go outdoor and walk, not because you are slim, you don't need exercise. Okay, we need the feel good hormone, right? Okay, to help us to feel good. Okay, so thank you for joining us. Together, we can help more people to understand this mental well-being and help more people to achieve this maximum mental well-being. Okay, thank you, Dr. Chin. Thanks for joining us today.
Thank you.